Alright, let's talk about the very first step of BLS, making sure the environment is safe. Before we get close to anyone who might need help, we have to pause and assess the scene. Take a good look around. Is there anything around that could put you in danger? Look at the ground. Are there cracks, uneven surfaces, anything you might trip on? And then look up. Is there something hanging that might fall? And of course, in the slide you see here, we have exaggerated the setting a bit with things like snakes, spiders, and even an alligator. But the point is real. Any of these dangers, even smaller ones, could put your own safety at risk. And yes, we all want to help. But if something happens to you, now we've got 2 people down and no one to help. So always make sure the environment is safe first. If you see danger, the right move is to eliminate the risk if possible or wait for the help that can deal with it. If I were standing in front of this scene here, honestly, I would not go straight into that room. I would call for help and clear the risks before going in. That's how we protect ourselves while still preparing to help others. Now, once we know the scene is safe, the next step is to check if the person is responsive. This is the moment when we approach the victim, someone who is lying on the ground and not showing obvious signs of movement. What most people naturally do here is actually correct. We lean in, maybe kneel down, and ask something like, "Hello, are you okay? Can you hear me?" That's exactly what we should do. As you can see in the image, we also apply a gentle shake on the shoulders. It's a simple but important combination. Give a verbal stimulus and a physical one. You're trying to see if they react in any way. Maybe they open their eyes, try to speak, move a hand. Any sense of responsiveness is important. But if there is no response at all, we have to move quickly to the next step of BLS. So again, first make sure it's safe, then go in and clearly check, are they responsive or not? Now that we have checked the scene for safety and confirmed the victim is unresponsive, the next critical step is assessing for breathing and a pulse. We do this quickly, within no more than 10 seconds, and both checks happen at the same time. In the second image, you can see that the rescuer is checking only the breathing. It is for demonstration purposes. In real life, it is better to check them together, so checking the breath and the pulse. To check for breathing, we look at the chest to see if it's rising and falling normally. We're not listening or feeling here, just scanning. If the person is breathing normally, we monitor them while we wait for help. But if they are not breathing at all, or if they are only gasping, that's not normal. That's a sign of cardiac arrest, and it means we need to start high-quality CPR right away. Gasping can be misleading, so we need to recognize it. It's called agonal gasping, and it can happen in the first minutes after a cardiac arrest. It can sound like a snore, snort, or a groan, and it usually comes with an open mouth and some movement in the head or neck. It's not a real breathing. It's a warning sign, and we should not delay CPR if we see it. Let's continue. While we're checking the breathing, at the same time we check for a pulse. In adults, we check the carotid pulse. Start by locating the trachea with 2 or 3 fingers. Then slide them into the groove between the trachea and the neck muscles. That's where you feel for the carotid pulse. Again, give yourself at least 5 seconds to find it, but no more than 10. If you don't definitely feel a pulse within that time, don't wait, start CPR immediately. Start with chest compressions. And ideally, by the time you're doing this assessment, someone else should already have called for help and is either on the way back with an AED or actively locating one. When checking for a pulse in an infant, we use the brachial artery because it's the easiest and most reliable site in that age group. And additionally, infant's neck is very short and it is very difficult to find carotid pulse. To find the pulsation of the brachial artery, do this. Place 2 or 3 fingers on the inside of the upper arm between the shoulder and elbow about midway. Gently press down and feel for a pulse. Just like adults, spend at least 5 seconds but no more than 10. If you can definitely feel a pulse, start high-quality CPR with chest compressions. In children, you can check either the carotid or the femoral pulse. For the carotid, use the same method as we did with an adult, and to check the femoral pulse, place 2 or 3 fingers in the inner thigh, midway between the hip and the pubic bone, just below where the leg connects to the torso. Again, take at least 5, but no more than 10 seconds to feel for a definite pulse. It's important to remember that in infants and children, it can be difficult to detect a pulse confidently, even if you are a trained provider. So if you don't clearly feel a pulse within a 10-second window, don't hesitate to start compressions. Also, keep an eye for signs of poor perfusion. This includes cold hands or feet, weak or thready pulses, and altered mental state like unresponsiveness and change in skin color, such as paleness, bluish tint around the lips or skins, known as cyanosis. These signs tell us the tissues aren't getting enough oxygen and help confirm the urgency of starting CPR.